we talked about edema last quarter in pathophysiology, and we talked about it a little more this quarter with regards to compression. And now I'm going to just briefly go over an overview of lymphedema and the type of treatment we do. And then in lab, we're going to have a certified lymphedema therapist come and talk to us and show us some techniques, which will be so much fun. So the learning objectives are just to be able to define lymphedema as distinct from edema, be familiar with basic treatments for lymphedema, and to be able to recognize a patient who is at risk for lymphedema and be able to communicate this to the physical therapist in charge. So even if you're not a certified lymphedema therapist, which as a PTA you can be, and in fact, the therapist who is going to come and speak to us in November is a PTA, and she's a certified lymphedema therapist. But even if you're not, you should be able to recognize and refer appropriately. So a lot of the specialty areas, if it's not your specialty area, you should still be able to recognize it and refer them to the appropriate specialist. So lymphedema is the accumulation of protein-rich fluid in the interstitial spaces due to disruption of normal lymphatic drainage, either from primary or secondary dysfunction. And we'll talk about primary versus secondary. So chronic edema, as opposed to lymphedema, so lymphedema is a type of chronic edema, but chronic edema is defined as any edema that's present for more than 3 months that affects any part of the body, and it's regardless of cause. So it's considered to be lymphatic swelling. Lymphedema results from the accumulation of that protein-rich fluid in the interstitial space due to an imbalance between capillary filtration, capillary resorption, and lymph drainage. So remember, those all work together. Hydrostatic pressure, osmotic pressure, they all have to work together to maintain homeostasis. And fluid balance is part of homeostasis. So lymphedema specifically results from a failure of the lymphatic system on some level. The lymphatic load is greater than the lymphatic transport capacity. So it's like too many cars on the highway, too much fluid in the system. Edema is noticeable by an abnormal collection of excess tissue proteins, visible edema, chronic inflammation, and fibrosis, which is the thickening of the skin and connective tissues. Lymphedema is frequently a complication of cancer and cancer treatment, because if lymph nodes are involved in cancer and they remove lymph nodes or dissect lymph nodes, that can cause the blockage in the fluid system and cause lymphedema in a particular limb. Lymphedema can occur anywhere in the body that has compromised lymphatic drainage. So we have lymphatic drainage everywhere, just like we have microcirculation everywhere. So these are the incidence of lymphedema: 250 million cases worldwide. That was as of 2022. In the US, estimated 3 to 5 million cases from all causes. The primary lymphedema is some problem with the lymphatic system or other vascular abnormalities. Usually it's congenital. It's a genetic mutation that causes that. So that is just, you just have lymphedema, you have to figure out a way to live with it. Secondary lymphedema is as a result of something else. So a result of cancer treatment or filariasis, which is a bacterial infection. So the primary is you're born with it, and secondary is caused by something else. Chronic edema, like we said before, is edema lasting greater than 3 months, and normal lymphatics have failed to remove the overload for whatever reason. So it's primarily caused by other pathologies or comorbidities causing chronic edema. So classifications of secondary lymphedema, so that's lymphedema caused by other things. So trauma or tissue damage could cause lymphedema, like lymph node dissection. Radiotherapy, if you're getting for cancer treatment, can cause lymphedema. Burns, varicose vein surgery, or vein harvesting. Large or circumferential wounds and scarring, so maybe burn scars, could cause edema. It can be caused by malignant disease, venous disease, infection, inflammation, endocrine diseases, and the types are listed there. I'm not going to read them all to you. Immobility and dependency. So if you can't move, you might develop dependent edema from paralysis. And some self-harm things can cause edema because of trauma and tissue damage. So those are um, classifications of secondary lymphedema. So there are factors that can reduce the risk of developing lymphedema. One of them is they it's called a sentinel node biopsy that they do with cancer treatment. They map the first node um, that's closest to the tumor, the one where the tumor drains, and it's marked by using a radioactive dye. And if the nodes are negative, then they don't have to remove any other nodes. So that's sort of like the least amount of surgery that they have to do, and that's a good thing. Maintaining ideal body weight. Lower weight means a lower lymphatic load. That's always nice. Being physically active, but not overdoing it. So you have to stay active, and it helps with all aspects of health, including improving lymphatic function. But you don't want to get crazy on that. You don't want to get crazy on anything, right? So you want to avoid injury to the at-risk or affected limb because injury causes inflammation, which causes swelling and edema. You want to maintain normal range of motion. Ability to move normally promotes good fluid return and decreases the risk of lymphatic stasis. And you want to avoid constriction or excessive pressure on the at-risk or affected limb because that might slow fluid return from the limb. So any kind of, there are lots of different things that can cause lymphedema. The most common thing in the US is cancer treatment or primary lymphedema, but it can be caused by other things. And worldwide, the most common cause of it is filariasis, which is a bacterial infection. It causes elephantiasis, which is a form of lymphedema, and it can be cured with antibiotics, and then the affected limb can be treated, and people can go back to normal, which is really nice. As far as other secondary lymphedema goes, there is no cure for it, so you have to manage it, and working with a therapist with conservative therapy for managing it is often a really good way to do that, to be able to live a more normal life. So the symptoms of lymphedema are tightness, swelling, or thickening anywhere in the extremity, burning or tingling sensation radiating down the extremity, complaints of heaviness or aching in the extremity, inability to wear rings, jewelry, or clothing due to edema, so your normal stuff doesn't fit, decreased flexibility in the extremity, and skin changes such as tautness, pitting, hair loss, or shininess. So in the later stages of lymphedema, there are a lot of times a lot of skin changes, and we'll talk about it. So normally, in our normal tissue fluid exchange occurs at the microvascular level in those capillary beds, and the lymphatics are all involved there too. So capillaries allow fluid, nutrients, and cellular debris to exit the bloodstream, and lymphatic channels allow for the return of fluid and cellular debris to the central circulation. So the pressure differences between the capillaries and interstitial spaces in lymphatics drive the process of filtration and resorption. So we've talked about this, and we're just kind of reviewing that information. So that balance between hydrostatic pressure and osmotic pressure are kind of what drive it. So the lymphatic system has a lot of jobs. One of the jobs is to preserve fluid balance in the body. One of them is to enhance and facilitate the immune system by removing waste products, etc., from the interstitial spaces. The lymphatic system also absorbs and transports dietary fats from the gastrointestinal tract, and lymphatic circulation. So our blood circulation, it's unidirectional, but it's in a closed system. The lymphatic circulation is unidirectional, but it's an open system. The ends of the lymph vessels there's an end to them, whereas the circulatory system, there's no end. So it's still unidirectional. It picks things up from the tissue spaces and goes to the heart. and returns it to the systemic circulation, returns that fluid to the systemic circulation. So, physical therapy is a really important way that can affect lymphatic return by a lot of the normal activities that we do in the clinic. So, respiratory movement, so teaching people breathing exercises, and there are specific breathing exercises that you'll do for treatment of lymphedema as part of complete decongestion therapy. Muscular contraction, like strengthening exercises, tissue pressure, like compression bandaging, pulsation of arteries that increases with active movement. So exercise increases the demand for blood. Remember how the cardiac output increases 5 times what its normal is when you're exercising. So that helps drive that fluid balance. And contraction of lymph angiones. So lymph angiones are the lymphatic vessels that contract to help pump the fluid, and active and passive movements stretch those and cause the lymph angiones to contract at a faster rate. So a lot of the normal physical activity that we do in physical therapy can affect lymph fluid movement, which that's a good thing. So the stages of edema, stage 0 is where it's latent. So you might, if you have lymphedema, these are stages of lymphedema. If you have lymphedema, you have it for life. You're not going to get rid of it. But you can be in stage 0, where it's latent, it's subclinical. There's no swelling noted, but there are histological findings that you can see if you look at tissues under a microscope, including microedema and fibrosis and dilated lymph vessels with stagnation of fluid. So even though you don't notice any swelling, there's stuff going on under the surface. So in stage 1, it's called spontaneous reversible. The edema disappears with bed rest or elevation and is soft or pitting. So it's very similar to venous edema, regular edema. It's hard to differentiate the two. One of the ways that they differentiate is by how the edema responds to manual treatment. But stage 2 lymphedema is spontaneously irreversible. The edema does not decrease with bed rest or elevation. It's non-pitting except with strong pressure. And there is tissue fibrosis or induration present where the skin feels firm and thick compared to normal tissue. And the edema becomes firm and the skin and tissue thickening begin to occur. Stage 3 is lymphostatic elephantiasis, where you have extensive fibrosis within the limb, hardening and thickening of the skin, papillomas of the skin, fat deposits, and hypertrophic muscle tissue develop, and deep creases at the joints. So you can see in this picture kind of the differences between the stages. So the pathology of lymphatic failure, you have a couple different kinds of failure. You have high output failure, where it's a dynamic insufficiency of the lymphatic system due to the lymphatic load exceeding normal transport capacity of an intact or normal lymphatic system. Low output failure is a mechanical insufficiency of the lymphatic system due to impaired transport capacity, which is less than the physiological normal lymphatic load. So suffice it to say, I don't expect you to know the difference between these really, but suffice it to say that there are different ways your lymphatic system can fail. So lymphedema occurs when the lymphatic system is no longer able to remove the normal lymphatic load, either because of primary lymphedema that you were born with or damage to the system from various causes that we've discussed, secondary lymphedema. So valvular failure results when the valve flaps no longer meet and the lymph refluxes, so it backflows into distal region. So just like our veins that have valves to prevent backflow, the lymph vessels also have valves to prevent backflow. You can have disordered contractility of the lymph angion in chronic lymphedema, which reduces the effective pumping power of these vessels, and so that it moves less fluid. So you still have the same amount of fluid, but the system isn't handling it the same way. It's like you have a water system and a few of the pumps aren't working. And so you can't move as much fluid as you could before those pumps shut down. So the structural failure of lymph vessels can be caused by trauma or inflammation or physical obstruction due to limb trauma from injury, surgery, radiation, tumors, or development of fibrosis in long-standing lymphatic congestion. So lots of things can cause structural failure of lymph vessels. Lack of normal mobility, both range of motion and functional mobility, can severely limit normal lymphatic return and contribute to the development of worsening lymphedema. So, if people are immobile after surgery or immobile after some kind of medical problem, it can exacerbate the problems with lymphatic failure. So, medical management's conservative treatments, of course, we like conservative treatments. That's what we do. So, complete decongestive therapy is one of the treatments, and we'll talk about what is comprised of that. Intermittent programmable pneumatic pumps, which is what the picture is here. Weight loss to help decrease total lymphatic load. There are some pharmacological therapies that are being researched that aren't quite out yet. Low-level laser light has been shown to be effective in some conservative treatment of lymphedema. There are also surgical management, but most surgeries for lymphedema are considered palliative rather than curative. So they they take the problem down, but they don't get rid of it. Most surgical techniques still require ongoing use of compression garments, and most surgical techniques result in decreased limb size, which improve function and mobility. So surgical and medical management are sort of the non-conservative things. And then the complete decongestive therapy is what we can do in physical therapy, manual lymph drainage, which we'll learn some techniques for in lab, compression of the involved limb, patient education, exercise, skincare, and home management. So the interesting thing about decongestive therapy and lymphedema therapy is that there are other healthcare professionals who do parts of it, but really only in physical therapy do we do all of it. So massage therapists do manual lymphatic drainage. Um, some nurses do compression and compression wrapping, and certainly everybody does patient education. But we're usually the ones that do all the rest of it when we do it all together. So that's nice. Physical therapy can be kind of your go-to thing. Um, for the interesting thing for PTA who wants to go into this, we have had PTAs we had one PTA who came through the program and she was really interested in this. And she lived in a small town where there wasn't a lymphedema therapist available, and the nearest one was hours away. And so she ended up becoming a certified lymphedema therapist, and she's able to provide that for her community. And what a great thing to be able to do so people don't have to go hours to get their treatment. They can just do it at home. So really nice. A nice thing a PTA can do. So, manual lymphatic drainage is a specialized massage technique to stimulate improved lymphatic drainage. So, the principles, which we'll learn some of these in lab too, we're going to treat the trunk and proximal areas before the distal areas. So, a lot of times we talk about this as clearing the trunk and proximal areas and then moving the fluid from the distal areas. We're using a light touch, so we're stretching the skin rather than stretching the muscle. So it's not like soft tissue mobilization that we have been doing. The pressure has to change smoothly to promote a pumping action in the tissue, and the direction of pressure is in the direction of fluid flow. So we're going like towards the heart or wherever we want the fluid to go. 5 to 10 strokes in each location is usually what you have to do. More is fine if you need that. So you're doing the pressure on phase in the direction of the desired fluid flow, and the pressure off phase, you're letting the skin spring back to neutral for each stroke. So you put on pressure and then you relieve it, and you put on pressure. So your pressure is always in the direction of the desired fluid flow. You want to avoid redness, pain, or soreness with manual lymphatic drainage. So it's a very light touch. Limb compression using multi-layer compression bandaging with short stretch compression wrap to help decrease fibrosis and maintain the effects of your manual lymph drainage. So usually you do manual lymph drainage followed by compression bandaging. The compression bandaging is trying to increase tissue pressure, increase the mechanical efficiency of the muscle pump, and decrease filtration and increase reabsorption. So the multi-layer compression bandage kind of creates a soft cast to make a cone shape, which makes the compression gradient, and it increases the effectiveness of the muscle pump to help drain the affected limb. So foam padding is used to shape the limb and protect bony prominences, and you apply it from distal to proximal with minimal stretch. And each additional layer is used to increase compression pressure rather than stretch to increase compression pressure. And we also want to maintain comfort and circulation for the patient. So, of course, the therapist is going to check for symptoms of any infection or any skin wounds or injuries, which may require medical management before you put on the compression bandages. So, skin care is a really important part of complete decongestion therapy. So, patient education, including the disease process, the treatment process, skin care, exercise, self-massage, compression garments, and home management. Exercise is recommended to maintain health and stimulate lymphatic flow through muscle contraction, pulsation of arteries, and deep breathing creates negative pressure in the thorax and helps with that fluid flow. So there are definitely exercises that are recommended to do for this. Skincare includes checking skin daily for injuries, washing thoroughly and carefully, especially between toes of the involved foot, and using moisturizers regularly. Someone who has a lot of lymphedema, they might not be able to see their foot or wash between their toes, so they might need help with that. Home manage of lymphedema is the goal following the completion of a program of complete decongestive therapy. So you want people to be able to manage their lymphedema independently. And the education you're going to give them is going to help them do that. So lots of precautions and indications. You can look through those. Obviously, any kind of organ failure or heart failure, kidney failure, liver failure is going to be a contraindication because we're moving fluid and we don't want to overload those failing organs. So I'll let you read through those contraindications and precautions. So why is it important to treat lymphedema? Edema contributes to poor wound healing because that extra fluid can cause changes in the tissue that don't let you heal. For every centimeter of increase in limb girth, it is 10 times the distance for tissue nutrients to move to provide nutrition for gas exchange and metabolism of waste products needed for wound healing. So it's pretty important to reduce that limb girth. Core wound healing and chronic inflammation it decreased overall health of the person, which puts them at risk for medical and functional complications through the rest of their lives. So, with adequate treatment of lymphedema, including a good self-management program, people don't have to live restricted lives due to their condition. It can really improve their life. And that's so important. So, lymphedema or chronic edema can easily be overlooked as a complication for many of our patients. It has an impact on wound healing and mobility. Pain can lead to poor progress or poor outcomes with rehabilitation and physical therapy treatment. So, by us having awareness of the issues and how they may be addressed, we can help improve the quality of patient care, including potentially decreasing complications as well as the patient's time in rehab. So, by being able to recognize some of these things, we can also refer appropriately if we're not certified lymphedema therapist ourselves, but refer them to someone who is so they can get the treatment that they need. It's a really important part of therapy.